man. Welcome back. You're still watching Ekse right here on channel 263.
Yes,
We're taking you all the
sir.
way till 5 p.m. So make sure you keep it locked. This is where we educate and entertain you
Yes, sir.
all at once. Now, I'm sure many of you guys at home are familiar with cancer. You've maybe heard your friend or your friend's mother or your mother or someone in the family has cancer. And today we're actually going to be speaking to Dr. Apffelstaedt, and he's here to tell us more about genetic testing and how it may, help prevent breast cancer.
Yeah.
Welcome, doctor. How are you doing?
Yeah, good afternoon. Good afternoon, viewers out there. Nice to be here.
Absolutely, man. Before we kick off with anything, I want to know more. Can you tell us more about the work you do as a researcher and surgeon, for heart and thyroid health?
Okay, yeah, it is so that for all solid tumors, like for example breast cancer, surgery is the only method that opens any chance of long-term survival. That's why it fascinated me.
Okay.
But it has also fascinated me why people get cancer.
Yes.
And genes are one of the major reasons why people get cancer. The other major reason is lifestyle.
Right.
We're going to talk about that later.
Right.
Let's talk about genes.
Yeah.
Genes is what makes us what we are to a large extent.
Right.
Because when your dad and your mom came together to make
Right.
you as beautiful as you are today, a sperm and a egg came together, and what became of you is a mixture of 50% of your dad and 50% of your mom.
Right.
And we can test now whether there are some mistakes in that predispose you to a high risk of cancer. Like, for example, there are some mistakes in certain genes that give you a 90% risk of breast cancer during your lifetime. 90%. That's almost being sure that you're going to get breast cancer.
Right.
The question is only when you would get it.
Yes.
Right. So I'm guessing that's what genetic testing is, just seeing what it is that is wrong with your genes, or rather that can give you
Yeah.
breast cancer
Yeah,
with your genes.
and it has also got a converse side.
Right.
If a breast cancer genetic abnormality is found in a family, there's always the chance, because you're half a father, half your mother, that you have inherited the healthy gene
Right.
from the other part of your family.
Right.
For those patients, it's always a great relief that they do not have this big risk.
Right.
Yes. And there's quite a big buzz about how genetic testing can prevent cancer. Can you tell us more about that? What are we looking into?
We cannot exactly prevent cancer, but we can identify risks.
Okay.
Number one, there are hardcore risks, the 90%ers. But then there's also a genetic group that has less risk, like, for example, how women metabolize estrogen.
Right.
There's also how you metabolize certain toxins. Just to give you an example, we know that not all people who smoke have a high risk of cancer, but there's a subgroup who cannot metabolize, who cannot deal with the toxic effects of smoke.
Right.
You can identify them. And they shouldn't smoke.
Right.
I mean, smoking in general is pretty
course.
bad.
Bad, yeah, for your lungs, yeah. Yeah.
But this shows you that not only can we identify certain risks, we also can identify certain metabolic abnormalities in people that expose them to a high risk of developing cancer later.
Right. And one might say that this is a scientific breakthrough. I mean, discovering something like this, or rather even the thought of the fact that we could be able to prevent breast cancer. Now, what are the positives and what are the negatives that come with this scientific breakthrough, as we call it right now?
I personally don't think that there are many negatives about
Okay.
it, because it places patients in control of their destiny.
Okay.
Previously, for example, if you had a strong family history, let's say of colon cancer, you wouldn't know whether it would hit you or not.
Right.
And maybe you had the healthy gene, maybe not. We couldn't test for it. These days we can test, and if we identify you have the healthy gene,
Right.
hooray!
Yeah.
If you have the disease gene, then we at least know how to get this risk down. Just to give you an idea,
Right.
if we identify a high risk breast cancer genetic abnormality, those that give you 90% risk of breast cancer, we can do a surgical procedure
And remove it.
Remember that one? That's the procedure she had, and that reduces the risk of breast cancer to less than 5%.
Okay.
So that's highly effective, highly
Yeah.
curative.
Yeah.
Wow.
But we're moving also into the next stage. I think we're going to see within 5 to 10 years that we can edit genes in humans
Yeah.
so that we actually can repair the genetic
Really?
defect.
Yeah.
And that is really exciting.
Yeah, that is really
That
exciting.
is
Yeah.
it's super exciting. And I know you mentioned that your lifestyle, the things you eat, the things you do can affect you as well, getting a high risk of cancer. So does that mean then the way that I live, I can lower my risk
Of getting breast cancer?
That holds true. I just want to give you an example.
Yeah.
I was running the breast cancer unit at Thyroid Hospital for something like 23 years. And in that time, we saw the breast cancer increase from 150 new cases per year to 550.
Wow.
And a large part of that is this avalanche of obesity that we're seeing.
Right.
And if you are obese and do not exercise, your breast cancer risk actually increases by more than 50%.
Wow.
And that's simple
I think it's a
lifestyle.
lot.
Yeah.
Yeah, 50 is an awful lot.
That
It is.
And you can conversely reduce your breast cancer
Right.
risk by exercising and keeping a normal weight.
Right.
Wow, man.
So is there a way in which, for example, also I'm a little confused. What if your family, let's say your mom doesn't have breast cancer, but how can she pass on a gene that didn't properly formulate in her? She's never had breast cancer, but she passes it on to a child or two people joined together. How does that work?
Yeah.
You know, if your mom
Just hold
didn't
the
have,
mic a bit closer.
if your mom didn't have breast cancer,
Right.
then your chance of getting breast cancer is lower.
Right,
But it's not zero.
Okay. Okay.
And if we're having one of those high risk genetic abnormalities,
Right.
it can also be transmitted through your dad.
Okay.
Okay. So men are often in the breast cancer genes
Right.
what we call silent carriers. They don't have cancer, but they pass on the gene.
Oh, I see.
Okay.
So- That is how it's explained.
Okay.
Okay, absolutely. Now, I have a friend whose mother had recently had breast cancer. And then everything was resolved, I would say, because I don't know the exact terms, but from my understanding that everything was resolved. She went for the chemotherapy, got radiation after things like that. But now her main concern is the cancer coming back, which is basically things that you hear. I had cancer and it came back. Is there certain things I can then do
To make sure it doesn't come
yeah.
back, precautions that I could take.
if I had cancer?
For most cancers, and most of the common cancers, early detection is paramount.
Right.
You know, if in our practice, we diagnose a woman with breast cancer by screening for breast cancer, an asymptomatic woman, no lumps in the breast, and we find cancer there, this woman is, for all intents and purposes,
Yes.
cured after treatment.
Yes.
However, if you wait till the cancer is very big, the lump in your breast is very big, the lymph nodes in the arm is swollen, then it becomes very difficult to
Yes.
cure you.
Right.
Yes.
So, first of all, early detection is paramount. The second point is healthy lifestyle.
Yes, sir.
I spoke just now about obesity, about smoking, about alcohol abuse.
Yes.
Right.
There's a good rule of thumb, and
Right.
it holds true for many cancers, but for breast cancer in particular. If you are obese, if you smoke, if you abuse alcohol,
Right.
then for each and every of those habits, your risk of recurrence of cancer doubles.
Yeah.
Okay.
Doubles.
Yes.
Okay, so lifestyle has an important part to play. Obviously, it is something that we can modify,
Right.
whereas at the point of diagnosis, once it's been diagnosed, we can't modify that anymore.
Right. And what are the key things that you feel like our viewers at home, our viewers are very young at home, and what are the key things that you feel like they should know about breast cancer as they grow up?
Yeah.
Okay, I think your number one is you must prod your mom to go for regular mammographic screening from age 40 onwards.
Okay.
Okay,
Okay, that's for your mom.
Yes.
For yourself,
Not for you, but for your parents.
I will look after our parents.
Yes.
And I can show you a WhatsApp conversation with my daughter. There are lots of hearts in there.
Oh,
man.
that's so sweet.
Absolutely.
Okay. So for yourself,
Yeah.
women, obviously, feel your breast for lumps.
Right,
Always same time of the month.
right,
It's after your periods.
right.
Because then the breasts are softest. And
Right.
if you feel a lump that persists until after the next period, go and see a doctor, have it worked out.
Absolutely. Thank you so much for that advice. It's absolutely amazing. Thanks for coming through and chatting to us and telling
Yes,
us,
sir.
educating us more on cancer, breast cancer, and also genetic testing.
Yeah.
It sounds like it's, every time there's new ways, coming to improve and trying to prevent, cancer as a whole as well.
Yeah.
And it's people like you that we have to thank, for putting in the time and the effort. Because I know Lwandile didn't want to study anything in the science field.
I
So
didn't.
thank you so much for coming through and chatting to us and educating us, man.
Yes, sir.
Thank you very much for having you. And as a last thing, as a parting shot, I may offer you a comment. Every 10 years, we
Yeah.
halve the mortality of breast cancer.
Right.
Every 10 years.
Yes, every
That's
10
cool.
years, you heard the doctor, guys. Doctor's
Every
orders, you have to
10
follow them.
Absolutely.
Doctor's
man.
orders, you have to follow them.
Listen, man, let us know on social media if you have received any information that you found useful. But right
Yeah.
now, we're going to take a quick ad break. When we do come back, we have lots more for you.
Yes, sir.
Every 10 years.
Every 10 years, I'm going.
You must go at 40.
Yes, sir.
Things like that.
Yeah, bro.
Awesome as that.